Welcome to Smart Women Talk. This is your host, Katana Abbott. I'm a midlife millionaire coach and a certified financial planner, and I search the world for smart women and a few good men, including best-selling authors and thought leaders who are on that leading edge. So join us for conversations on money, business, health, and inspiration so you can live with more purpose, passion, and prosperity. Hi, everyone. This is Katana Abbott, and I want to welcome you to Smart Women Talk. Do you know that there are 10,000 baby boomers turning 65 every single day? And each of them will have to make a choice about which Medicare plan to purchase. You don't want to blow this, not at all. There's some huge decisions to make. So I am speaking with Medicare expert Danielle Roberts. Specifically, we are going to be exploring how to understand the Medicare maze, and it is a maze, the tools for becoming confident in your healthcare choices, and the roadmap to understanding Medicare. So let me tell you a little bit about Danielle. She's quite a star in this area. Danielle Kunkle Roberts is the founding partner at Boomer Benefits, a national insurance agency specializing in Medicare since 2005. She's the author of the best-selling book, 10 Costly Medicare Mistakes You Can't Afford to Make, and is a frequent source for major news outlets such as CNBC, Fox, Yahoo Finance, and Kiplinger and MarketWatch. She has also appeared on more than 200 podcasts, radio shows, and TV segments to educate the public about Medicare. Danielle, welcome to Smart Women Talk. I'm really excited to have you here to talk about this, because not only about the 10,000 baby boomers, but because I'm turning 65, and I know a lot of people turning 65, and we really don't know what to do. I'm getting a better idea because I've been doing a lot of research, but I am so thrilled to have you here. Welcome.
Yeah, thank you. It's my pleasure. And it's such a good point you make, right? Because we spend our whole lives having our employers provide our health insurance to us. And maybe if we're lucky, we can choose between two plans that they have provided, maybe an HMO or PPO, but they're the ones that do all the research. And then we just sign up for the coverage. And then suddenly you turn 65 and you're out here with Medicare, and there's literally 4 parts, 10 supplements, thousands of drug plan choices. It can get pretty confusing.
Yes. And so, you kind of think it's simple, like I just have to do regular Medicare or Medicare Advantage, and it is very complicated, just like Social Security is. Why is Medicare so confusing? Why didn't they just make it simple?
Yeah, it's a good question. And I would concur that Uncle Sam got this one wrong. But when Medicare was created back in the 60s, in the beginning, all we had was 2 parts. There was just Medicare Part A and Part B, and that was actually modeled after the old Blue Cross and Blue Shield types of plans that they had in the 60s. We've all seen the little emblems. There's hospital coverage and medical coverage. And so Medicare built something very similar, and it felt similar. As time has gone on, though, insurance in general, health insurance in America has changed. When Medicare was rolled out, it was not common for people to get dental or vision or hearing coverage from their employer. That was something completely separate. So this is one of the reasons why we have Medicare, and it doesn't include people say, well, do they think that my eyes and ears just don't need care after I turn 65? Well, no, it's just that they've never updated Medicare to include that in the basics. And then we complicated it by adding in the managed care plans, which are an answer to folks that don't have extra coverage for supplemental insurance, but still need to do something. And then they added in the outpatient drug coverage, which should have been part of it in the beginning. And what you're left with is sort of this alphabet soup with all these different things. And people confuse terms like parts and plans. And so I think this is just bureaucracy at work. It's not always the best development of things. Insurance companies actually do a much better job of outlining Medicare than the government does, but it is a very popular and beloved program. And if you know how to set it up properly to meet your needs, you will come to love your Medicare plan. And it is very solid insurance.
And I'm assuming that just because you're married doesn't mean you and your spouse get the same plan.
Correct. That is so
We
true.
could talk
Every
about
single
that.
person is, yeah, you're your own person. And here's another difference, right? Because when you have group insurance, you can carry your spouse, you can carry your dependents. And yet, if you come into Medicare and there's two of you that are 65, you each are going to set up your own separate coverage, just like you'll each have your own separate Social Security checks. So CMS views every individual as their own person, and therefore you'll have your own Medicare parts, your own Medicare premiums, and your own Medicare plans to choose.
Right. And the reason I was mentioning that is you may have one spouse that's super healthy and another spouse that's on a lot of medications. And so we're going to go into that in a little bit, aren't we?
Yeah, and you're right. There could be completely different needs for insurance. And so it's important that people break away from the idea that they should get on the same plan, because that is not always the case. And it's perfectly okay to have two different types of insurance when you have a big disparity in your general health like that.
So I mentioned to you before we started that I have gotten this barrage of mail. One was really nice, a nice old-fashioned snail mail letter from a guy explaining all the different parts, which I thought was very nice. I got something from, of course, Blue Cross Blue Shield, which I've had for 40 years. Or over more than that, 40 years. And I also received, AARP, of course, and other ones, but I received an invitation to a dinner seminar at one of my favorite restaurants. So people have to be so confused by all of this.
Yeah, the marketing really makes it worse, because if it was just dealing with learning the Medicare parts, it would be one thing, but you have so many different insurance companies competing for your business. So the average person who is 64 and a half will have 20 to 30 telemarketed phone calls a day from different insurance companies and their agents out there just trying to get on the phone with you to win your business for Medicare. And then you get this stack of mail a foot high that is on your desk or kitchen table, because you're not even sure what you should keep and what you should throw out, because you're so unfamiliar with the terminology. It's hard to tell what is something you should keep that's from the federal government versus something that is a slick advertisement from, say, a Medicare Advantage company or a Part D drug plan. And so what I see happen a lot is it leads to total paralysis. People are afraid to make a decision. They're literally paralyzed into inaction on their plans. And then there's often a scramble at the last minute because it was something they dreaded so much. And so that's one of the things that, we have really set out to do through many means of marketing, but especially in having collaborations with professionals like yourself that can get the word out there so that people can sort of have a breakdown of the parts into simple terms. And if you spend even just 30 to 60 minutes learning some of these basics, you will find there's a point where it'll click and it all comes together. And we just find that a lot of people are so overwhelmed by the time they get started that they may not actually finish that last part. And it is really important to give yourself time to learn that so you don't have to make last minute choices that might not be the right ones.
Yeah. Oh, absolutely. Absolutely. And I know there's nonprofit organizations that have volunteers that can help people. But when someone's approaching 65, they need to make this really important decision about what plan. First of all, do I do traditional or do I do like a Medicare Advantage type of plan? And they have to understand what all that is. And I don't know that everybody does. And I just want to share a story with you that is just so heartbreaking. I do these seminars twice a year on Social Security optimization. And a really nice couple came in and they were interested in Social Security, but they said they had this problem. He was approaching 70 and they were down in Cancun on this vacation and he did not plan on coming back to work. They were going to do this vacation and then, get all set up with their Social Security. And while he was down there, he had a heart attack. And while he was having the heart attack, his wife was, trying to take care of the insurance. The hospital in Cancun would not take his Medicare Advantage card. And lying next to him is a Canadian. They took his Medicare card, but they wouldn't take one from the United States. And I'm thinking it's because our system's too complicated and they don't understand if which company are they going to be dealing with. and he had Medicare Advantage. So there was a whole bunch of other complications that I don't want to go into, but they had to pay because it was a life or death situation. And they've been waiting for Blue Cross Blue Shield, and you may know what this is, some global organization that is going to review and decide what they will and won't pay. And it's been probably over 90 days. And they've heard nothing. And, when you have a heart attack, the last thing you need is stress.
Yeah.
I'm sharing this because he said I could share it. And what is the number one thing besides grandchildren and golf that people do when they retire?
Travel.
They travel. They travel. So can you talk about this? I did a little bit of research on it, and I'm understanding now why travel insurance is so important, but also the type of Blue Cross you buy can also affect if you have coverage overseas.
Yeah, that's right. So with Medicare itself, original Medicare Part A and B, you do not have travel coverage. You're not covered outside the United States. There are some very limited exceptions to that, such as if you were on your way to Alaska and traveling through Canada to get there and you had a heart attack and you had to go to the Canadian hospital because it was closer, Medicare might approve an emergency situation like that. But in 99% of circumstances, when you're outside the country, you should have travel insurance. And knowing that if you're an original Medicare, you don't have coverage, you could purchase a Medicare supplement, and certain supplements have up to $50,000 of emergency medical care. It's 80-20 though. They're paying 80%, you're paying 20%. And that can be quite a hardship for some people if you spend a lot of money. And that coverage, for one, only goes to $50,000, which wouldn't have been sufficient, of course, in your friend's situation. And also, being outside of the country, we don't know what kind of things that they charge for healthcare that we don't down here that would have been rejected anyway. So with an Advantage plan, typically they say that you have worldwide emergency coverage. And so what may end up happening for your friend is that he's going to pay these bills and he'll have to file for reimbursements with his Advantage plan, and some of that may be covered. But the reason they probably chose the Canadian insurance is Canadians, they have a national healthcare and it pretty much covers them anywhere. And so it doesn't matter that they were in Mexico. But with the US, Medicare Advantage plans are network plans. They're HMO or PPO based. And so if he was in an HMO, typically there's not coverage outside the network. So there might be some squabbling over what constitutes an emergency. In my opinion, a heart attack certainly would be that, but you have underwriters and people looking at that, and they're going to make those decisions. And then the other thing with Advantage plans is, even if you had a PPO plan, you have the ability to go outside the network, but the provider that you're seeing still has to agree to bill the plan. And it sounds like in this circumstance, that hospital decided no, they would not agree to bill the Blue Cross plan, which is why then this all falls back on the consumer. And we have seen this before where people enroll in Medicare Advantage plans, and then a serious health condition arises, and the specialist that they really need to see is at the Mayo Clinic, and the Mayo Clinic says, nope, we're not going to bill that. So it can get very dicey if you don't understand your coverage. And really, if you're going to do Medicare Advantage coverage, you're going to travel overseas, you probably need to have some travel insurance. And even if you had original Medicare and a Medigap plan with that $50,000 benefit, I would add to that while you're outside the US. That only covers you for the first 60 days outside the US, by the way, as well. So what if you took a 90-day world cruise or something like that? You would run out of that coverage after the 61st day.
Wow. And there are a lot of different travel policies.
Yes.
Now, do you recommend any certain companies?
We don't work with any at our agency. That's not a line that we cover, but I know clients who have purchased them pretty easily through their travel agents. And then I believe there are plans available not both through Blue Cross, which has something called the Geo Blue program, and then Cigna, I think, also offers worldwide coverage. So you might be able to purchase an individual plan like that either covers you all the time or covers you for a limited time during the travel.
And especially people that travel a lot.
Yes.
I met people, I was on a cruise last February, and I met people that are on cruises all the time. Yeah. And they do have medical there, but you really would want to have some kind of coverage especially if there is a situation where you need to be taken off the ship. So,
I agree.
okay. Well, that's good. So let's talk about the tools. So we're getting bombarded and all that. What are the tools that are available to us that we can explore?
So there's several ways you can go about learning about Medicare, but I think we can break them down based on the way that you learn. So if you are someone that likes to educate yourself on audio or video, YouTube is a great place to go. We have a channel there, Boomer Benefits. I think we have around 60,000 subscribers right now. And I put out new videos on a variety of Medicare topics. You could spend several hours looking at yours truly if you wanted to learn it there. There are lots of other people that have Medicare videos that are on YouTube. So if that's a way that you learn, that's a good option. If you're more of a reader, then you can Google any number of Medicare words. The Medicare.gov website itself has a lot of great information. They have made huge improvements in that website over the years where it's quite functional and helpful now. And it's a great website. You can visit our blog at boomerbenefits.com. Again, lots of information. We offer webinars. That's a great way to learn. So you can come and hear an expert online from the comfort of your own home. We spend about an hour breaking down the bits and pieces so that by the end, someone has a good understanding. So just depending on the way that you learn that information is out there, there are books and brochures that you can get. And so I just encourage people a minimum of 6 months to 1 year ahead of time. Start researching however you normally do your research, whether that is online or you like to dig through YouTube. You can go to Amazon and purchase a copy of many different Medicare books. We have one, but there are others out there as well. So whatever medium works for you, start your research there. And then once you have come up with a pretty good understanding, you're going to find that you have some questions. There's some questions that you just probably weren't able to figure out on your own. And that's when it's a great idea to reach out to an agent, somebody that does this for a living and has been doing it for a while, so that you can make contact with them, ask the questions that have come out of your own research, verify some of the information that you learned. And of course, then most agents will be able to provide you with quotes for the different types of coverages that you're interested in, which can help you sort of boil everything down until you're ready to make that decision.
Right. And you have an ebook that we were talking about because I bought it. It's on my Kindle. Mm-hmm. So is that is the 10 mistakes?
So my book is 10 Costly Medicare Mistakes You Can't Afford to Make. And there's a hard copy version that you can get for $10 on Amazon. The Kindle is even cheaper. That's true. And what happened there is our agency has tens of thousands of policyholders all over America. We've been doing this for almost 20 years. And I noticed a trend when we would have our client service team dealing with Medicare issues, because the unfortunate news is setting up your Medicare is just the beginning. On the back end of that, there are going to be things that happen that you won't know how to handle. You'll get a bill in the mail and you don't understand why. You're not sure if you actually owed it. Why didn't your policy cover it? You may have a referral that doesn't go through or a prior authorization that pens. They'll run into drug exceptions at the pharmacy. And if you don't have a reputable agent that you've worked with to get your policies enforced, you're going to be dealing with all of that on your own on the back end, and it can be quite scary. And what we figured out is people, when they're making their Medicare decisions, when I was talking with our client service team manager about this, they're making the same mistakes in all of those same areas over and over again. So if we took the group of Medicare beneficiaries at large, 10,000 people a day aging in, they tend to make very similar mistakes to the other people that are aging into Medicare. And you only learn that in hindsight later on down the road. So we set out to write a book that would address exactly that, the fear of making a mistake in the Medicare coverage that you set up. And so the book is all about the common mistakes that people make and how you can avoid them and set yourself up for coverage that you can rely on and that you can sleep peaceably at night knowing that you have in your wallet or purse or pocket.
Fantastic. Yes. And I think that's really important. So I want to talk about two things. That period, like I'm in right now, we talked about it. Mm-hmm. I have till October 24, which means my plan would start October 1st. So I better get that taken care of now. Mm-hmm. But then does everyone also have an election period? And talk about the significance of those things, because I know it's important.
Yeah, these two periods that you mentioned are the two most important periods in the life of any Medicare beneficiary. So Medicare gives everyone a 7-month initial enrollment period. In the industry, we call it the IEP, during which you can sign up for Medicare. Now, if you start taking Social Security before you become eligible for Medicare at 65, you will be automatically signed up for Medicare, and your Medicare A and B card will just show up in your mailbox 1 to 2 months before you turn 65. They will assume that if you're taking Social Security, you're no longer working and you probably need health insurance, and they auto enroll you. So that's a small percent of the population, though, because so many people, as you well know, today will wait and take their Social Security at their full retirement age or even until age 70 so that they can earn all of those delayed income credits and make sure they get the highest possible check. Those people need to enroll themselves in Medicare during their 7-month window, and that starts 3 months before you turn 65. It goes through your 65th birthday month, and then it goes for 3 months after. So it's specific to you. And if you enroll in the 3 months prior to your birthday month, your benefits would start on the first of the month in which you turn 65. If you enroll in your birthday month or the 3 months after, your benefits will start the month after you do the application. There is one caveat. If you happen to be someone born on the first of any month, like a June 1st baby, you could actually get your Medicare 1 month early, May 1st. And you know that Social Security has some weird little rules like that as well. So it's just one little thing in there to complicate things. But this is when you want to get signed up for Part A and B, unless you are still working and have creditable employer coverage from a large employer, which means an employer with 20 or more employees. Those folks could delay enrolling into some parts of Medicare or all parts of Medicare until they retire, because of course their group insurance already provides them outpatient coverage and drug coverage. And so there are people that will delay at that point. But the significance of the initial enrollment period is if you miss it and you don't have other creditable coverage in place, ultimately when you sign up, you will pay a 10% higher Medicare Part B premium every single month for the rest of your life based on how long you waited. So if you waited 12 months, then you would have 10%. If you waited 24 months, it would be 20%. I have met someone once that was 72 and had a 70% penalty. And because you have to continue paying that every month, it can be quite expensive. So you want to make sure you get enrolled in the initial enrollment period unless you have that creditable coverage. Now, this period is also the same time that if you don't have other coverage or retiree coverage from an employer, that you would be making choices about what coverage you add to Medicare to fill in the gaps. Medicare covers about 80% of your outpatient expenses. Nobody wants to pay 20% of an outpatient surgery or 20% of chemotherapy. So this is where people will choose to enroll in things like a Medicare supplement or a Medicare Advantage plan. And so you're making all of those choices, which parts you enroll in, which type of coverage you go with, all during that early part of your 7-month window, and you just got to get it done by the end. The annual election period, which happens in the fall, is for people who are already on Medicare. And if they are enrolled in either a Medicare Advantage plan or a Part D drug plan, then they can change that plan from one plan to another during the annual election period. It runs from October 15th to December 7th. And you might be on a Medicare Advantage plan, and there may be some changes coming for the next year. You get an annual notice of change in the mail. Maybe they're increasing the premium or they're dropping one of your important medications. You get that notice in September so that you could use the annual election period to switch to a different plan or perhaps return to original Medicare. So the annual election period is for making choices about plans that you already have, but it only pertains to Medicare Advantage and Part D. It does not pertain to Medicare supplement plans. Those you can apply for anytime. Of course, most times you're going to go through underwriting to get a Medigap plan in many different states, and you may or may not be eligible for one if you miss your initial enrollment period. So this is some pretty tricky stuff, right? Because you would hear about annual election
period. And let's
go
back to what you just said.
Mm-hmm.
So you said the period I'm in when I have not started.
Yes.
It's my initial period. Can't I choose either traditional and the Medigap plans without underwriting during this period?
Yes.
And And if I select to take Medicare Advantage, which is an HMO or a PPO, and usually there is different underwriting or no underwriting, tell me if I'm right on this.
Mm-hmm.
And I decide to switch from Medicare Advantage to traditional, let's say a year, 2, 3 years later, when I have a health concern, I'd have to go through underwriting. Is that true?
Yeah, that's true. And so in my book, it's chapter 8, we call it the big mistake, because people will often be healthy. They're healthy at 65. And so they say, I'm not going to buy a Medigap plan right now. I could buy one, but why would I want to spend that? I'm taking one medication on maintenance and I'm pretty healthy, so I'm going to wait. And there are millions of people that do this every year, by the way. Well, you only have 6 months from the start of your Medicare Part B to enroll in a Medicare supplement and get that without underwriting. By the way, Medicare supplement and Medigap plan, same thing, just 2 different terms. So you have a 6-month window to do that. But it's confusing because you hear about this thing that happens in the fall, which we call the annual election period to differentiate it from your initial enrollment. But a lot of people just commonly call it the open enrollment. And doesn't that term make you think you could just sign up for any plan that you want to without underwriting? It sounds like that, when the reality is that period doesn't apply to Medigap. So if we had, let's say, someone on my team and you were calling to work with him and you had, let's say, multiple sclerosis or osteoporosis. Let's talk about any treatable but not curable condition, which we would often refer to as a chronic health condition. If you reach out to him and you're in your initial 6-month window for Medigap, he's going to know that it's really important, if you want a Medigap plan, we've got to get you covered in that 6 months, because later down the road, if you wanted to enroll, you would have to answer health questions, and then an underwriter would probably look at that and say, that's going to be expensive for us to treat that. We're going to decline this application. And so in the insurance world, there's something called adverse selection, which is that people always want to buy insurance after they get sick, and they will do that if given the opportunity. But this 6-month window exists to make sure that insurance companies don't go belly up paying for claims only when people have joined after they're already sick. So it's an important piece to know, because if you want a Medigap plan, that is your golden window, especially if you have a health condition. Now, you might be healthy and enroll in Medigap, and then you get a rate increase in a year or 2, and you can switch to another Medigap and you can pass the underwriting fine. But none of us knows when we'll get sick. So it's important to be insured right from the beginning.
Wow, that is amazing. And not many people know this. Now, so with the Affordable Care Act, I thought they got rid of underwriting, like they can't underwrite health insurance. Why is it that with Medicare, they can turn you down or decline you?
So a couple of reasons. Affordable Care Act only applies to people under 65. So it was never intended to replace Medicare. And if you have an ACA plan, then you turn 65, you need to leave your ACA plan and transition to Medicare, or else you could end up with a late penalty down the line. So that's another one that people sometimes get wrong. But here's why what you're saying, which is very common, that people will be like, well, I thought the Affordable Care Act fixed this problem. Well, the Affordable Care Act guarantees that you can get primary coverage. Medicare is primary coverage. So when you turn 65 and you're eligible for Medicare, no one's going to give you any hiccups about signing up for Medicare if you do it within your 7-month window, right? You're getting your primary coverage in place. Medicare supplements are an optional thing. You're adding to your primary coverage, and therefore they are not bound by any of the underwriting rules that the ACA legislation was designed to fix. And if you don't understand that Medicare only covers 80%, and that you would be on the hook for deductibles in the other 20%, which is different than how insurance goes when you're under 65. You could have somebody that literally waits, and we see this happen where someone is trying to get treatment and they don't have a supplement and they only have original Medicare, and they may not have access to the same medical care because the hospitals or doctors don't want to provide coverage that they may not get paid for.
Wow.
Yeah.
So, I mean, adding another layer to this, right?
So true.
Wow. Okay. So do you think we've covered the difference between Medicare Advantage and traditional now?
So I would add just a couple of things. When someone chooses to stay with original Medicare and add a Medicare supplement, the primary reason people choose that option is freedom of access. because when you have original Medicare, no matter which insurance company you buy your Medigap plan from, you can use that coverage at any provider nationwide that accepts Medicare. There are over 1 million Medicare providers, and that coverage is going to pay exactly as it's supposed to, whether that coverage is with Blue Cross or Humana or Aetna or Cigna or United Healthcare. They all are the same. They're standardized by the federal government. So if you are a kind of person who says to myself, hey, if I get cancer, I probably would want to treat at MD Anderson, one of the arguably the best cancer hospitals in the world, if not the whole US. And if I go to MD Anderson with an Advantage plan and they're not in the network, I can't treat there. But I want to have that option to be able to treat anywhere I want. This is why people typically choose Medigap plan, because of you don't have to choose a primary care doctor. You don't have to get a referral to a specialist. You get to choose where you go and get your care as long as they accept Medicare. That's the main reason that some people choose Medigap. With Advantage plans are much, much cheaper. When you enroll in an Advantage plan, the Advantage plan bills Medicare, and Medicare pays them over $1,000 a month to take on all of your medical risk and deliver your care. And the way that they do that affordably, so that the Advantage plan, which is an insurance company that's in business for profit, the way that they do that affordably is to create a network, usually an HMO or a PPO. Well, now to get the best price on your medical care, you really need to treat in the network, because if you go outside of the network, you either don't have coverage, or that outside provider has to, one, be willing to bill the plan for you, and two, you're going to spend a lot more. Maybe in the network, you would have a $20 doctor copay. Out of the network, you might pay 40% of the bill. So Advantage plans tend to be chosen by people who really know that they want to treat locally at home. And even if they did have a serious illness, they're probably going to choose care right there in their own city or in those few counties. And that might be a good fit in that direction. But you are essentially, they're cheaper because you're giving up some of that access. You can't just go to the Henry Ford Center in Detroit, because it's going to be outside of the network. And those are the two main differences. One plan that you can go anywhere, but it's more expensive because of that. And then another type of coverage where you have networks, but it's a lot less expensive and premiums because of that.
Okay, so the last thing I want to talk about is cost, because I know there's some plans that are better for people that don't have a lot of money.
Yeah.
But even with Medicare Advantage and with the traditional Medicare, with the Medigap, there are costs. So even if you go with the Medicare Advantage where you think there's no out of pocket, aren't there deductibles and co-payments that you get hit with in the back end? Like if you get lab work and x-rays and that kind of thing.
Yeah. So when we do our webinars, the way that I explain it is, with a Medigap plan, you're going to have higher premiums up front, but a lot more predictable, low cost sharing on the back end. With an Advantage plan, it's the opposite. Much lower premiums up front. Some of them have what's called a zero premium. They don't even charge you for the plan, but you're still going to pay for Part B. You have to be enrolled in that to enroll in an Advantage plan. And when you enroll, if you're working with a good agent, they're going to go over the summary of benefits with you. And in that booklet, it will show you all of the costs associated with what you pay as you use the care. Maybe your plan has a $5 doctor copay, but another plan might have a $30 doctor copay. What you want to look for when you're reviewing an Advantage plan is, what do I pay on the big stuff? If I get cancer, am I going to be paying 20% of my cancer bill? Or if let's say you have kidney issues, is dialysis 20%? A lot of Advantage plans on the more expensive items, they will charge more. But on the flip side of that, they do have a cap on the plan. It's called the maximum out-of-pocket limit. That's the most you could potentially spend on Part A and B costs on that plan in 1 year. So if someone is working with our agency and they really want an Advantage plan, we're going to be looking to see which plan in their area has their doctor in the network, their drugs on the formulary list, and has the lowest out-of-pocket maximum possible, because that's, of course, better for the beneficiary.
That's fantastic. And then is there a way that Medicaid and Medicare work together, or you don't need that anymore?
So Medicaid is insurance for people that have very low incomes, and you're eligible for Medicaid at any stage of life. You can, if your income is below a certain percentage of the federal poverty level, you can qualify for Medicaid. Medicare, everyone is eligible for that at 65 or even younger. If they had a verifiable disability and they got SSDI, they could get Medicare under 65. Now, let's say you were both. You're turning 65 and you're living at 150% of the federal poverty level. Then you could have Medicare as your primary and Medicaid would function as your secondary. And then you wouldn't need a Medicare supplement because that Medicaid sort of functions like that. One caveat being that you have to make sure you treat with doctors that take both Medicare and Medicaid. Medicaid is not accepted by all doctors, so you may have some limits in your choices. But considering that care would be pretty much free or very low cost when you have Medicare and Medicaid, people in that income bracket often do choose to use Medicaid as their secondary.
Right, and they set it up that way because they know these people couldn't pay the deductibles and co-payments.
Exactly.
So,
they need the help. Yeah.
Yeah, absolutely. So, wow. Okay, we did it, didn't we? We covered
a lot.
And you are just full of information. First of all, do you have one last tip that you'd like to share?
Yes. One last tip is whenever you leave your employer insurance, whether that's right when you turn 65 or whether it's when you're 68 or 69, about 2 weeks after that coverage ends, you will get a letter in the mail called a certificate of coverage, credible coverage. This is the testament to the coverage that you have had, and you always want to keep that. It's really important for people who are enrolling in Medicare after 65. And you know that we have so many people that work well beyond 65 these days. Well, if you later change from that and you're now going to go on Medicare, Medicare doesn't know that you've been working and that you had that credible coverage. You have to be able to show proof of that. And that letter that you get from the insurance company is so important. A lot of people don't know what it is. They toss it, they throw it away. They say, oh, this pertains to my insurance that I'm not on anymore. And it's a real hard to get that later, but you need it to make sure that you don't end up paying a Part D penalty and potentially a Part B penalty as well. So make sure that you save that letter. It's super important.
Perfect. What a great tip. That's a money tip.
Yes.
Okay, wonderful. So for people that want to come visit your website, it's pretty simple, boomerbenefits.com. And I Googled Medicare and boomers, and your website's right at the top. Good job.
Thank you.
So they go to Boomer Benefits, but also let them know, how they can reach you and what's there in the book. I want them to know that. And then
Yeah, you got it. Thank you. So one of the easiest ways to make contact with us is on Facebook. We have a free private Facebook group. It's called Medicare Q&A with Boomer Benefits. You can join that group, and we have thousands of other Medicare beneficiaries in there. It's free. You do not have to be a Boomer Benefits client to be part of the group. What's amazing about the group is you can post a question 365 days a year, and you will get an answer within a few hours from someone on my team. But what's really great about it now, since it's such a thriving, vibrant community in there, I often find that some of the folks in there that have followed us for a while and really learned Medicare by doing that, or perhaps they've become a client, these folks will jump in and answer each other's questions, sometimes before we can even get to them. And so you have the opportunity to learn about Medicare from your peers that are already in it, as well as having questions answered by us. And of course, we moderate all the comments. So if someone gets an incorrect piece of advice, we're quick to jump on that. But it's really a fun group. People in there are amazing and really share a lot of great information. So that's one good way to get to know us. And then, yes, the book is 10 Costly Medicare Mistakes You Can't Afford to Make. And you can find that on Amazon or Barnes & Noble. And it's a great takeaway, something you can highlight. It goes over all the costs of Medicare, the enrollment periods, the options that you have, lots of things to avoid in there, things that will save you money just by simply knowing that, oh, this isn't something that I should do, or, oh, this is something important. It's a step I need to take care of.
Oh, this is great. Thank you so much, Danielle, for being here, taking time from your busy career and life to share this, because it's really going to help a lot of people today.
Thanks for helping me. I really enjoyed our conversation.
Absolutely. Okay. And everyone, I want to thank you for being here and joining us. Remember, you can come to joinsmartwomen.com and you can become part of our community. You will have received our monthly newsletter. You'll know who's coming up on the show. There's articles, resources, and gifts in there. You'll also get free access to the Smart Women Academy. So it's Join Smart Women. So until our next show, go out and live with more purpose, passion, and prosperity. Smart Women Talk is brought to you by Smart Women's Empowerment, a 501c3 nonprofit project of United Charitable. Music by Bill Lucas from his album When It Rains. Available on Apple Music and Spotify. Catch us wherever you listen to your favorite podcast, and be sure to join our free community at joinsmartwomen.com to access all our free Smart Women resources.